Shoulder bursitis is one of the most common complaints for people dealing with shoulder issues. Typically presents with pain when you're trying to abduct the arm out to the side, or if you're lifting or carrying things, can also be painful. And in more severe cases, we also have patients that complain about sleeping on that side at nighttime because you're compressing that bursa. Now, from rehabbing many patients over many years with shoulder issues, the biggest reason why people struggle to fix shoulder bursitis is because they chase the symptom and they don't address the root cause. So what we're going to do in this video is break down how, if you understand the root cause, it becomes super simple to actually fix the shoulder bursitis, and we'll take you through the exact step-by-step that we use with our patients in the clinic to fix the underlying cause, get rid of the symptoms, and fix the shoulder for good. So understanding the root cause of the shoulder bursitis, we first got to understand some basic anatomy of how the shoulder functions. So we take a look at my very rudimentary drawing here, and one of our clinicians commented to say that it looks like a sideshow bob, so apologize for that. But here's our humerus, which is our arm bone, okay? We've got our acromial process, which is part of the scapula, and then the clavicle at the front through here. Now, this blue drawing over there is a bursa, or subacromial subdeltoid. We've got our supra, which is one of our supraspinatus, one of the rotator cuff muscles, and then we've got another bursa underneath here. This bursa here is the one that's most commonly aggravated when we're dealing with shoulder bursitis. Now, it's important to understand that this space underneath here is what we call the subacromial space. Sub meaning below, acromium, so below the acromion. That space there is very important because it allows us to have good range of motion through the shoulder and move it as we require. Now, the issue becomes with the bursa, and this is where the bursa becomes inflamed, is when it gets aggravated, as you can see there, it swells up and it's going to occupy more space. So our room underneath the acromion or subacromial space becomes smaller. And that's why when you lift your arm out to your side or you're lifting or carrying things, you actually end up squashing and aggravating that bursa itself. So, as we can see there, again, the humerus, we've got that subacromial bursa and that space underneath the acromion. When it becomes inflamed, and again, something else is causing aggravation, that's where that bursa swells up, there's less room, there's less space, and then that's where we can end up pinching on that bursa itself. But the key here to understand is that the inflammation of the bursa is a secondary issue. There's something causing aggravation to that bursa. Now, simplistically, what we often see is three categories for that when it comes to the shoulder bursitis. So number one is a lack of rotator cuff strength. Number two is that we are lacking shoulder stability. And then the third one is that we are lacking shoulder movement and control. So those are the three common signs that we see, or common underlying root causes. Each of them is going to result in an overload of that bursa, where we create more stress, it becomes inflamed and aggravated. So what we're going to do in the rehab is actually address all of these, and we're firstly going to start off with creating some more room, which is with our what we call shoulder humeral depression. So we'll start there, and then we'll build up some rotator cuff strength and shoulder stability. So let's get stuck into the humeral depressors. All right, so the phase one, what we're trying to do here is achieve some humeral depression and to help manage the symptoms. So when we talk about humeral depression, there are muscles that attach to the shoulder, and basically when muscles act, they move the shoulder itself, or the humerus. Now we've got humeral elevators, which again, if this is the humerus, this is our acromion, they elevate, and again, your bursa sits underneath there, so they elevate the humerus. We want to work the opposing muscles, which actually depress the humerus. They create more space for that bursa to sit there so it doesn't get as compressed and therefore doesn't get as aggravated. So that's what we refer to as the humeral depressors. We're going to show you exactly those exercises that we recommend. Two of them super easy to achieve, and they're going to help to create some more space, take the pressure off that bursa. For the humeral depressor exercises, we're going to do two very simple and very effective ones that are going to be targeting our lats, teres major, a little bit of teres minor as well. What we're going to need is a band and then somewhere to attach the band. Now, ideally, you want the attachment to be above shoulder or head height, and that's because we want to be pulling down and in towards ourselves. So the first one we're going to do is a single arm row. So you hook it up here again, and our emphasis is the elbow down towards the hip. So we're going to focus on from here, pulling down, nice squeeze with like a 3-second hold, and then coming back up. And that's really going to activate or switch on that lat, which is a big key humeral depressor, as well as working a little bit of teres major and minor in that position. So 3-second holds, we like to do about 15 to 20 reps per set. Then from there, we like to work on to what we call the armpit squeeze, which is going to buy us a little bit more of your teres major in this one. We're still getting a bit of lat, but we're going to get a little bit more teres major and a bit of pec, which also is a humeral depressor. So what you do for this one, loop the band just below the elbow, and then what you want to do is focus on staying 90 degrees to the band there, and you're going to pull your arm into your side, 3-second hold again, and then back out. 1, 2, 3, and then back out. So again, 15 to 20 reps per set for that one, and we like to aim for 3 sets of those guys, and those are going to help to create more space, take that pressure off that bursa, and kickstart that rehab. So after we've created some humeral depression, take some pressure off that bursa, help to manage some of the symptoms, the next phase is to build some rotator cuff strength and also some shoulder stability. What we're doing here is trying to build that shoulder function so it can handle more load, handle more range of motion, again without compromising that bursa. So let's take you through some of those. So the first exercise in phase 2 is going to be some isometric external rotation. Now in this position, we like to keep our elbows tucked in by our side because again, abduction out to the side can still cause some irritation to that bursa. So arms tucked in nicely by our side. We're holding a band, and what you want to focus on from here, keeping your elbows tucked in by your side, and you're going to pull apart and we're going to hold. I like to do about 8 to 10 second holds. So to show you from side on here, arms tucked in, we're going to rotate out, 8 to 10 seconds, and we like to do 10 reps of those. Those are nice ones for our external rotators of that shoulder. Then the next one we like to do is going to be requiring a weight. Now you can use a dumbbell as we've got here, or like a water bottle or something similar. But what we're going to do is actually be lying down on our side. And again, we're going to work the external rotators of this position. So get nice and comfortable, hold the weight down by your side, keep your arm tucked in. We're going to rotate up and then coming back down. And you really want to focus on the rotation. So it's not like you're trying to lift the arm up, you're trying to rotate it back towards your back pocket. And that's going to really work the external rotators and some of those upper shoulder muscles as well. And we like to stop at elbow height. And that's going to keep that resistance nicely on the external rotators. This one we like about 15 reps, and again, 2 to 3 sets either side. Then, to work on some of the upper back muscles in particular, we're going to do our face down shoulder lifts. From this position here, arms start down by your side, and all you're going to focus on is lifting your hands up as high as you can off the floor, 3-second hold, then back down. Again, hands up, 3-second hold, back down. So we like to do 10 reps with that position, then we flip our hands over. Now in this position here, your external rotator is having to work a little bit harder, 3 seconds and back down. Again, hands up as high as you can, keep your thumbs slightly higher than your pinkies, and back down. 3-second hold, and then back down. So those are 3 great exercises that we like to start off with at this phase, and they're going to build some of that rotator cuff strength and also start to get some of that shoulder blade stability working those muscles. So that's our phase 2. Next is phase 3. So after we've had the humeral depressors and we built some strength through rotator cuff and some shoulder stability, the final phase we want to increase your capacity. So we're going to challenge that shoulder through different planes of movement under some more load, and this is where we start to integrate some return to sport specific stuff. So you can tweak it required based off your demands, whether it be sport, work, or otherwise. That's what we classify as return to sport. So let's get into those. In this phase, as we said, we want to build functional capacity. So it's going to look slightly different for each person based on their demands and their needs. But what we want to make sure we're ticking off in this phase is to expose the shoulder to different range of motion and different planes of motion, introduce some weight bearing into the shoulder as well, and then also introduce some faster force production and force absorption with some open chain pliers, which we'll get into. So one of our ones that we like to start off to introduce the shoulder into different planes of motion is the window washers. Now we're using this band here. Again, you can just use a resistance band and tie it to a stable object. We'll have more information in the description below as to common ones that we use, but we want to set it up and basically tie it to an object where it's lower down than your shoulder height. And from here, we like to break this down into 3 parts. So we've got the pull back, the external rotation, and then the punch up. okay? And then we control back down, rotate, and back down. So again, we're getting those different planes of movement there with the traction, external rotation, punching up, and then control back down, eccentric, and then back from there. So that's a good way to get that shoulder exposed to different planes of motions, challenge that stability and the rotator cuff in those different planes of motions. So that's our window washers. Then we like to actually add a bit of load to the shoulders, because when you add a little bit of load and weight bearing, you actually help that shoulder get more what we call centrated, which is to the middle of the shoulder in this joint, and you actually get more feedback from proprioception as well. So one of the ones that we like to go through from here. Now you can do this in a kneeling position, or you can do it in a full push-up position, whatever works best for you. And we're going to do some slide outs from here. So what we're going to do is arm slides out, we're slowly lowering down, and then coming back up. Here, and you want to maintain that constant pressure with that hand that's sliding out. Obviously this hand's going to be taking most of our load, but make sure we control, keeping some pressure there, and then dragging back in. So that's another one that we like to have for the weight bearing variation. And then finally, one of our common ones that we like to do for this, we're going to play around with some quick force production and force absorption. So with this guy here, I like to set up in a band, we have our arm up, and this is really, we use it a lot with our throwers. People who do a lot of throwing position with their arm. We like to go from here. We want to try and keep that elbow up at 90 degrees, and we're going to do what we call shoulder tantrums. So from here, you're just whacking back and forth, and that's creating a lot of force that you've got to absorb and generate, and we're trying to keep that elbow up nice and high. Don't let it drop down, keep it up nice and high, and then again, you're trying to go back and forth as quick as you can, and that's going to really challenge that quick force production, force absorption in a different plane of movement, overall increase your shoulder capacity. So there we have it. Understanding that shoulder bursitis is a secondary issue is key to fixing shoulder bursitis for good. The bursa becomes inflamed and aggravated because something else is causing the issue, whether that be rotator cuff strength that's lacking, lack of shoulder stability, or even lack of control and movement. You've got to address those to fix the shoulder bursitis for good. So that's where we broke down those phases, phase 1, phase 2, and phase 3. Again, you can adapt them based off what you require and your specific needs, but hopefully that will guide you through. Now, if you're still battling with shoulder bursitis and you've given these a go, feel free to click on the link below. It'll take you to our webpage where you can find out more information about more detail on the shoulder bursitis, the anatomy, all that relevant stuff that can help guide you as well. And if you need help, feel free to click through and we can get in contact with you.